All right. Well, hello everyone, and welcome to this week's lesson on food animal surgical nursing. I'm using a different format today. I'm using Zoom to record the lecture, and there are a few goofy things about Zoom. One is that if I screw up, we're stuck with it. I can't edit anything. So if I pick my nose, then we're stuck with it. I will try not to pick my nose. And there are other times where I have to switch the screen, so you'll just have to look at my big fat face while I'm fumbling around. But we'll break this into three smaller lessons, and you can take a break in between each one. Certainly, if you have any questions, just email me, call me, and then I can try to answer any questions you have. Okay, so let's begin. I said, let's begin. Okay. All right. Well, a lot of what we've learned from our small animal surgery labs apply to farm animals or food animals as well, right? The importance of a thorough physical exam, appropriate fasting times, appropriate anesthetic agents, knowing the adverse effects of those agents, monitoring and recovery, um, and and there's a few differences. Some of the agents have a different effect on 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 food animals. Also, we have to be aware of withdrawal times for meat and milk as well. So we'll talk about that in a moment. Um, I prefer the term farm animal over food animal because, for example, the I'm going to turn subtitles on, even if we don't need them. I prefer the term farm animal because certain animals are used for fiber and not food, and then some animals may even be a pet. You'll certainly see a lot of pet goats and pigs. We won't be talking much about pigs today. In fact, we won't be talking at all about pigs, just because they're not in the chapter. But things we've talked about with dogs and cats and horses and farm animals, some of it can apply to pigs too. Pigs certainly get umbilical hernias, for example, and some pigs are neutered and spayed and things like that. Okay, so but our emphasis will be on cows, and then we'll talk near the end of today about some issues small ruminants. But to begin with, I wanted to show you two cesarean sections um, performed in two different cows. So this first one is going to show you a C-section at Penn State. There's no subtitles, but I'll just tell you what's going on. This is a planned C-section. It's not an emergency, and this is a very valuable calf. This is an embryo transfer calf, meaning that it's kind of like she refers to it, the veterinarian refers to it as in vitro fertilization or IVF, where they've taken an embryo and they've actually placed it in this cow. And this calf may be too big for the cow to deliver normally. And so that's why they're doing a C-section. And as you watch, you can just kind of ask yourself, well, how is it similar to the video you saw of the dog, and then how is it different? it's something I have to do that's a little unusual. I have to, whenever I play a video, I have to change screens. Okay, right. Okay.
Today we had several cows coming in for elective C-section. So this is a little different than the C-section performed on a cow that's having a problem giving birth. So these cows are not actually giving birth at the time, but we know that these calves are ready. So these cows have been induced. And so these calves we know already. And these calves, the reason for the C-section in these calves is because they're basically an assisted reproductive technique. So they're actually, these cows are pregnant by IVF type method, and the calves are actually much larger than the cows can probably have a good chance to deliver on their own. So we do C-section on them because they're quite valuable cows and also very valuable calves. And so we kind of avoid having problems with the delivery process. And the thing that we deal a lot with in calves is this fetal-maternal mismatch. And so the fetus is much bigger than what the cow's pelvis allows for the calf to come out. And so because it's an elective procedure, it's fairly straightforward. All right, leg needs way back. The big thing to do is stimulate the calves, so monitoring them for their own, they're breathing on their own, you monitor their heart rates when they come out, and any activity that they show us indicates that they're doing well. So within the first couple of minutes of being born, the calves should be moving, they should be breathing, they're breathing regularly pretty quick initially, but it should be a nice steady rate, have a good heart rate, and also showing a lot of movement. And so they should also develop a suckle reflex within the first, 1 to 2 minutes, and be able to hold their head up, shake their head, and then also give them vocalize like a lot. And that's a good sign to us that the calf is definitely ready for birth and is doing well. So we're not required to do anything else to help them along.
All right, so you noticed a few things similar, right? There's, it was aseptic. They were in, they were in gowns and gloves. They're stimulating the newborn. Some differences, of course, are that that the patient is awake the whole time. I mean, the cow, the mother is not under anesthesia, and I wanted to point out. Wanted to show you something that I will talk a little more about in just a moment. You notice what are they doing right here, right? They've shaved her in the just in the lumbar area, and they're actually injecting lidocaine here, and that's called the paravertebral block, and we'll talk more about that in a moment. Other differences are they're using chains to get the baby out. I don't know if I mentioned, but of course, those are awfully gigantic gloves they're wearing. There's a lot of people involved to deliver the one baby. So anyway, so that's one way of doing a C-section. Now let's go and look at another way of doing a C-section. The more common way. Oops. Sorry. let's see. Okay. All right. Okay, now this is a far more common scenario. So this is again a C-section. This one would be an emergency C-section, as you'll see. This is Dr. Cody Creelman, who has a vlog called Palpation Nation, and they're really interesting. I think he does a really good job, I think. So it's Dr. Creelman and a veterinary student, and I'll let you notice some of the differences here.
Most name brand bars and body washes you rub on your skin are classified by the FDA as synthetic detergent.
So that's his intro. Start around here, I think.
Looks like the boys need a little help with this one. Get some lube pumped in there, then I'll take a feel. Calf's come in normal position. Things are just a bit dry. It's a big calf, and she's kind of fat too. You guys might want to cut back on the oats. Okay, we tried to get the baby out the back. What did we try for? 10 minutes? 10 minutes wasn't going to come, so now we're going to cut the baby out the side. The baby is alive right now. Fingers crossed the cow stays up. We're going to do our best.
Hold up, get loose. Who's up, who's who? Who's me, who's you? I don't even know, cause I just took two. 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 Just took two.
Okay, strong boy on this side. This side.
Good enough. All right.
And you gotta put your initials next to her so they know who did it. No, she's standing. Stassi's standing.
Big Stassi.
You want a picture with her? Yeah, I'll take one with your phone.
Yay! So I just wanted to rewind and just show you a couple of things. So you probably noticed it's not quite as sterile, but it's actually still pretty sterile. I mean, they're doing, the best they can. There was a, she's certainly gloved up. These are called obstetrical gloves, and they're sterile too. They come out of a little sterile packet. I like how they put the little garbage bag here, to try to protect the surgical site. Then Dr. Cody has sterile gloves and sleeves on as well, and the farmer gets involved. Of course, the farmer is just touching the calf. Where is that? It gets over here, I think. Oops, I missed it. But once they get they're cutting into Cody. Dr. Cody is holding the uterus, and then the veterinary student is cutting into it, into this horn to get the baby out, and then the farmer gets involved. And the stuff they were spraying on her, it's called like an aluminum bandage. Again, just kind of an antiseptic. And the writing your name is no joke. You really do have to write your name or your initials, because if the farmer has 3,000 or 30,000 animals, they want to know which, who did the surgery. If the cow is not doing well, they want to know which of the veterinarians to call. A lot of places I worked, we had 3 or 4 or 5 farm animal veterinarians, and you just put your initials. Okay, and I'm just gonna the ends of his vlogs are always very entertaining. So I was just going to show you the last couple of seconds.
Hold up, get loose. Who's up, who's who? Who's me, who's you? I don't even know, cause I just took 2.
I want to hear.
Scared of my gas hole.
Anyway, okay, so that's our introduction. I realize we've just spent a lot of time on that. Okay, so our objectives for part 1 here, we're going to describe general considerations unique to any farm animal surgery, with a focus on bovine. Some of this will be a review. And then we're going to spend in this first part talking about gastrointestinal surgeries. And so we're going to describe some regional analgesic techniques. We'll identify some unique features of ruminant digestive anatomy. Again, this should be a little bit of a review. We'll describe some, again, just like with any surgery, we want to know what's unique or important for each surgery, and that includes preoperative, intraoperative, and postoperative. Each one has, something that's a little different about it. And sorry, I'm just kind of glancing at my notes here. Okay. So, for preoperative in particular in a cow, what's unique? Well, one is the fasting period is really long. Remember, they have this giant first chamber called the rumen, and the rumen is not like my stomach or your stomach. You can never really empty a rumen. So they have to be fasted for almost 2 days. And then water is removed for 12 hours. However, it's amazing how many surgeries you can do without ever having to do anesthesia. So all those surgeries you saw, those cows didn't have to be fasted because they were not under general anesthesia. And so when I worked in farm animal medicine, um, we didn't own an anesthesia machine. We did everything with either short-acting injectable agents. Um, um, and on small ruminants, I don't think we fasted them for 48 hours, but we probably just fasted them overnight. But we mostly, these were short procedures. We used a lot of local anesthetics. Anyway, so the nice thing is you don't usually have to fast them at all, or you don't have to fast them that for 2 days. We mentioned that once you start working with food animals, we have to take into consideration withdrawal periods, whether it's antibiotics, analgesics, anesthetics. We have to make sure they're when I say licensed, what I should say is, are they approved? Are they FDA approved or not? There are a lot of drugs that are not FDA approved for farm animals, but we can still use them because there's no alternative. And we have to know what the withholding time is. And that's important because, for example, my wife, she's allergic to certain kinds of antibiotics. And if we used antibiotics in this cow and then her milk or she was slaughtered for meat, there could be small amounts of that antibiotic in her milk or her meat, and that could trigger an allergic reaction in someone like my wife. And I realize these subtitles are a little goofy. A great place to visit. I apologize if we've done this before, but this is it's called the Food Animal Residue Avoidance Data Bank. I showed it to you in the online pharmacology course. It's kind of a partnership between the FDA and various veterinary schools, and it's really a great resource. So, for example, I can go down here and I can request advice. I can look for FDA approved food animal drugs, or I can go here. WDI stands for withdrawal. It must stand for withdrawal interval. Yeah, withdrawal interval. So, for example, let's say I have to use penicillin let's say I was going to eat Fibonacci. This may not work, but let's say I really want to eat that cute little lamb, Phoebe. And so I go over here to sheep, and I can look up different drugs. All right. And let's say I used Banamine on him for pain. All right. Or even better, here's meloxicam, right? That's Metacam. That's what you used in your surgery cases. That's the non-steroidal anti-inflammatory. So I used Metacam, and it's telling me that I need to wait 15 days. It tells me the dose, the oral dose here, and I've got to wait 15 days before I can slaughter and eat Phoebe. Okay, it's kind of a grim example, but just to let you know, but FARAD is really the place to look for meat and milk withdrawal. And oh shoot, I think I didn't even show you the screen here. I'm sorry. This whole time you've been looking at. Remember what I said about goofing up? So let me just show you. Here we are. We're at FARAD. I'm just going to back up here. So again, this is the Food Animal residue avoidance data bank. And there's WDI, and I can go pick, there's different species. I can pick sheep, and I can pick my drug. All right, there's meloxicam. So anyway, sorry about that. Okay. And what are some of the actual drugs we could use? I mean, you may recall we learned about how alpha-2 agonists are really great in ruminants. We have to be really careful because ruminants are exquisitely sensitive to alpha-2 agonists. But for a gigantic patient like this, it's a good thing. It's good that they're sensitive because you can use a really small amount of xylazine, for example, and it's good for pain. It's a good sedative. We could also use butorphanol, or even though that's not a great pain medicine, it does provide some pain control. And we use lots of local anesthetics too. So we can use all these together, use a non-steroidal anti-inflammatory. There's only one that's FDA approved for cattle, and that's flunixin, also known as Banamine. And like I mentioned, one of the most important tools we have is doing some sort of local anesthesia. So I'm going to show you both a line block as well as some regional anesthesia techniques. And these would be used for some of the surgeries we're going to talk about. We're not going to talk about ruminotomies. I'm mostly going to talk about the surgeries that are the most, I don't want to say the most important, but they're certainly the most common. In all the years I spent working in the Central Valley of California, I did, hundreds of left displaced abomasum surgeries and other surgeries I'll show you. I never met anybody who ever did a ruminotomy. So I'm not going to talk about ruminotomies, but you're going to read about them. This is just going to show you, right, we have all these nerves coming off the spine, and what we need to do for abdominal surgery, for gastrointestinal surgery, is we need to find a way to block these nerves here. And so one technique would be a line block. We'll learn about the inverted L block, and we'll learn about the paravertebral block. Some of these video clips I'm going to show you are they're from Egypt or India, and they're not bad, but you'll notice in some of these videos, like this one, this guy is not wearing any gloves. But I think the technique is appropriate. So a line block is just like you did in our dog space. You're just putting a line of lidocaine. It has to get not just under the skin, but through the cow's muscle all the way to the peritoneum, because the surgeon is cutting through the muscle and the peritoneum. It's the least challenging of the methods, but the disadvantage is there's lidocaine in the surgical field. It just gives the tissues this sort of jelly-like edematous appearance. I've never heard of it causing a problem, but in theory, it could disrupt healing. It could disrupt, for example, you could get infection or dehiscence. But in all the years that I've seen people use it, I've never seen a problem. And remember that local anesthetics, they do take time. Typically, we would give it about 10 minutes, and you'll see later that that works out okay. You put in the lidocaine, and then by the time you finish your surgical scrub and the surgeon gets the gloves on, it's been 10 minutes. But this is just going to show you, I don't know why the Nutcracker, I don't know why we're playing that music, but anyway, so you can see how sensitive the cow is. Not a very good clip job. Look at the borders. It should be a perfect square. That's lidocaine. So now he can put the needle in, and the cow is numb here. Again, that is not a very good clip job. That's kind of ragged looking. So it just looks nicer to make it a nice square. And he didn't really look like he was putting it in the deeper muscle, but maybe he did, and he just didn't film it. Okay. A different technique you can use is called the inverted L block. Here, the lidocaine, I've outlined in red where the lidocaine is put. And so these are the spinal nerves. And I remember these can be both sensory nerves bringing information up, as well as motor nerves sending actions down. And by putting the lidocaine here, I mean, you would wonder, why can't you just put it here? But I think there's other little nerves that are not shown. So by putting this lidocaine in this L shape, this upside down L, it's going to block any nerves coming that way. It'll block any nerves coming down that way. And now the surgeon, I realize this is kind of goofy, but now the surgeon can cut here, and the cow won't feel anything. Okay. There's no lidocaine in your actual surgical field, so you don't get that jelly-like appearance. It won't disrupt healing. The disadvantage is it does require a lot more lidocaine, and so there is a risk of toxicity. Lidocaine can cause. We know it's actually used for to stop certain arrhythmias, but it can also cause certain cardiac problems if you give too much, including, I don't even know what cardiovascular collapse means, but I'm assuming that it's going to cause some sort of dangerously low blood pressure. Seizures and coma are possible. In all my years, I worked with, I either worked with or interacted with upwards of 20 or 30 farm animal veterinarians. I never heard of a cow having an adverse reaction to lidocaine. And just as a close-up, again, all the motor nerves will be blocked, and you place it just caudal to the last rib is where you would begin, and then ventral to these transverse processes. And again, you'd want to give the lidocaine 10 minutes to take effect. Okay, this is what you saw at the start during that C-section at the veterinary teaching hospital. And this is what we actually did. This was what my boss taught me to do. Dr. Jen Fitchhorn and Dr. Bruce Vandestieg taught Dr. Nell Moore and I to do this. And then we taught Casey Souza, our RVT, to do it. And what's being done here is, again, you're looking at the lumbar vertebrae and the thoracic vertebrae, so T12, T13, and then the first, second, and third lumbar vertebrae. And what's happening here is lidocaine is being placed right where the nerve is exiting the spinal cord before it has a chance to branch into these smaller nerves. And I don't know if you'll see this in the video clip, but so again, these sensory nerves are being blocked. They can't transmit information to the spine. And then the other kind of, it's not a bad thing, but it blocks motor nerves. And we don't see this with the, we don't see it with those first two techniques, but you'll actually see the spine of the cow will curve. And that's a way that you know that the block is working, is as it numbs and relaxes all these motor nerves, that side of her will I don't want to make this too wordy, but just you'll see her spine just the way she's standing, she'll kind of bend a little bit to whatever side you numbed. This is nice because you use way less lidocaine. Again, I've never seen a problem, but less is usually better. The disadvantage is it is more challenging, but what happens is, and you don't really see this too well in this video, but you insert the needle and then you feel the needle contact the transverse process, and then you just walk the needle off the transverse process. The moment you can feel it drop off, that's where you place your lidocaine. And it was very effective. And again, that's Casey Souza there. She was our RVT down at Sierra View Animal Health in Escalon. And now she is married with kids and has cows of her own. So this is, but this was on a Saturday, so Casey was not there. So this, you're seeing me doing part of the block. And again, I put this here as an insert. So there I am, you know, putting the lidocaine just off the transverse process. Right, so we're in the milking parlor, and this has all been shaved, and I've probably done an initial surgical prep. Again, I've got my sterile gloves on. There's my little surgery table. I think I've shown you this before. You can't really see, you can't really tell that her back is curved, but this whole area, not only does it use less lidocaine, but it covers a much bigger area, and that's important. You can use this technique for a C-section as well, and sometimes that calf is so big that you need to extend your incision. Well, if you didn't put lidocaine there and you try to extend your incision, you know, oh, it won't let me do that. Never mind. Oh gosh, are you kidding me? Anyway, if you do a line block and you need to extend your incision, she's gonna feel it, and that's not good for her, and it's not good for you, because it's not good for the veterinarian, because if she starts kicking, right, that's could injure you, and she could injure herself and break sterility. I wanted to show you this. This is that same day. There were two cows. These cows had they both had left displaced abomasum. And so I'll show you that in a moment. Nell is doing the same technique, the paravertebral block, but Nell was from New York, and they do the surgery on the right-hand side. And again, we'll talk a little more about that. But here's Nell. So there's just Nell shaving the right side of the cow. Not Mel, Nell. And if you work in the Modesto area and you like working with sheep or goats or cows, if you get a chance, she is awesome. So I strongly recommend trying to work with Nell more. She works at Mid-Valley Large Animal out of Ceres, which is near Modesto. Anyway, that's just Nell putting on her sterile glove. There's the farmer, one of his employees. He's holding the tail up just to prevent the cow from trying to kick me. So we'll come back to the actual surgery. First, I think it's helpful to talk about the actual, it's good to just be reminded of the actual physiology of ruminants. So hold on here. Okay. So you remember a cow or a goat or a sheep, well, and even a llama or alpaca, they don't just have a single stomach. A horse does, a rabbit does, but the ruminants and the pseudo-ruminants, they have this thing called a rumen, and that's what we want to talk about a little bit because it'll help us understand what's going on here. So we're looking here at this. You can see all the parts here, but just to appreciate that we're looking at the right side of the cow. So on the right side of the cow is where we have this thing called the omasum and the abomasum. And on the left side of the cow is where we have the rumen. And the rumen, you may recall, is this giant fermenting vat. When the cow eats grass or hay or whatever sort of supplements are being added, grains or cottonseed or whatever, the rumen is nothing like a stomach. It's this giant vat. It's not acidic like the abomasum is the true stomach. It's just like your stomach. It looks like your stomach. It's got stomach acid. That's the abomasum. It's called abomasum because it's next to the omasum, abomasum. But the omasum is not we don't see a lot of illnesses with the omasum. But the rumen, very large, holds gallons and gallons of food and liquid. There's just this teeming with protozoa and bacteria, and they're all helping. They all play a different role to digest whatever the cow is eating. The cow can't break down cellulose. The cow cannot break down cellulose. None of us can. Termites cannot break down cellulose in wood. Termites and ruminants have protozoa and bacteria that break it down. And that's what's happening here in the rumen. There's liquid, yesterday's forage, and then today's forage, and then it produces these things called volatile fatty acids, which we don't need to talk about. but that's the energy source for the cow. Anyway, that's the rumen. Most of the problems you'll see are actually the abomasum, but it's important to remember that the rumen is on the left side, and I'll talk about that. But just to appreciate the rumen, let's watch this little video about Furtus, the fistulated cow. And I think that'll help you appreciate what the rumen does.
K-State visitors took an inside look at veterinary medicine this April at the annual All-University Open House. Furtus, the Veterinary College's fistulated steer, starred as the main attraction of the Roaming in the Rumen demonstration, which is presented by the student chapter of the American Association of Bovine Practitioners. Furtus features a fistula, or hole, that allows access to his rumen, or the first digestive chamber of the bovine stomach.
We allow people to go look inside the rumen to see how all the food and nutrients is being digested, and how the animal is able to convert all the grass and hay that he eats into this high quality product that we all consume each and every day.
Having the fistula allows Furtus to fulfill several important duties for the college.
Furtus plays a vital role in our ability to educate veterinary students about the ability of cattle to digest forages and basically teach our veterinary students about digestive health in cattle. The other function that he has is that he is actually a therapeutic animal, and so Furtus is a normal, healthy, happy steer, and we use him to take normal rumen fluid that allows him to digest forages and transfonate that fluid into a sick animal to help them recover from disease. And so cattle that are sick for any reason get digestive disturbances, much like people get stomach upsets. And we take the rumen fluid from Furtus, we put it into the sick animal, and that helps speed up their recovery. And so we like to think of Furtus as saving as many cattle as we do in the state of Kansas.
Originally selected for the special surgery because of his temperament and overall health, Furtus's approachability allows open house visitors to directly observe the digestive process.
Inside the rumen, they're seeing the digested nutrients, seeing the microbes, how they're metabolizing the hay particles, and they're also watching them move around. So that's kind of a cool opportunity to see how they can use the food nutrients that humans are not able to, and able to produce high quality end products.
While visitors were offered other ways to learn about the rumen, including microscopes that showed off the microbes found in the bovine stomach, Furtus is always the star of the show.
I think one of the nice things about having a fistulated cow on display like this is that it's a big draw for the public. And our mission through Open House at the College of Veterinary Medicine is to get people exposed to what we do. This is a tremendously vital industry. There are lots of opportunities for students in this industry. We want people to come to the college and see the veterinary profession as something they might like to do. And we're trying to reach out and impact young kids and their decisions about what they might want to do with their life. And Furtus plays an important role in that.
While he has been with the college for more than 10 years, Furtus should continue to educate students and the public for many years to come.
We've had animals with these fistulas in until they're 20 years old. And so, you know, the life expectancy of these animals is actually longer than most cattle because we're not milking him. His purpose isn't for meat. His purpose is to teach. And we should have Furtus for a good long time.
Let's see, hold on everyone. Oh, sure, maybe. So he mentioned how they can actually take this liquid from Furtus and put it into a sick cow, a cow that has some sort of digestive upset, and they can take all of Furtus's healthy rumen juice or rumen liquor, it's called, and put it into a sick cow. I don't know why they call it liquor. It's not liquor, but the and that's called transfaunate. Yeah, the subtitles are not going to get that right, but it's called transfaunation, and it is, you know, can only be done if you have a fistulated cow, but it's kind of cool, I think. I like where she says, "Is that corn?" Okay, so moving on. So now let's talk about what's actually happening. So as far as surgical nursing and surgical diseases. So one of the diseases we see will involve the abomasum. And so the category is called abomasal displacement and volvulus. And what it really means is you can have the abomasum displaced to the left. That would be called a left displaced abomasum, or LDA. The abomasum, here's the abomasum on the right side of the cow where it belongs. And with left displaced abomasum, this is what happens. The abomasum floats ventrally and then ends up then floating dorsally to the top of the cow, right? We're looking here, this is like we're underneath the cow. We're not on top of the cow, we're underneath looking up. It's like we're lying on our back, and then that's her abomasum getting displaced over here onto her left side. This is a very common condition in dairy cows. And it happens in those first few weeks, usually the first 1 or 2 weeks after calving. Most dairy cows are high producing, and they're all being fed a high concentrate, low roughage diet because they're making milk. Milk requires a lot of calories. So these cows are being, they're being fed appropriately for what they're doing. We don't want them to lose excessive weight. We want them to have enough calories, but it also means that they're at risk. Their rumen won't be quite as full, and the bigger issue is there's usually something else that's making the cow not want to eat. There's something that's reducing her appetite. It could be low calcium. She could have infection of her mammary glands. That would be mastitis. She could have infection of her uterus, metritis. Maybe she's burning so many calories that now she's burning excessive fat and getting ketosis. And then these things make her eat less, and then her rumen is not as full, and now that can allow that abomasum to just float underneath. If she had a really big full rumen, the abomasum probably would not float over, but now that the rumen is not so full, and plus there's no calf in there either, there's just more room now for this abomasum to be displaced. And it's also possible, we call it right displaced abomasum. Oh, I wrote abdomasum. That's a typographical error. It should be right displaced abomasum. Of course, the abomasum is already on the right side of the cow. So when we say right displaced, it's not really twisted, but I'm not sure what it's done exactly. It's kind of flipped a little bit on its side. It's rotated just a little. That causes a right displaced abomasum. not as common as a left displaced, or the abomasum can twist completely, and that's called a volvulus, and that would be an emergency. To diagnose an LDA or an RDA or an AV, we listen for what's called a ping. And you're going to see in this video, you'll see the veterinarian. She places the stethoscope on both the right and left side of the cow, and then she flicks the cow's skin with her finger. And in the video, the ping should be much harder to hear, and it would be much higher pitched. This sounds like some sort of a Chinese gong. It would really be more like if you were to ping a basketball, you'll hear this ping, ping, is what it should sound like. Also, in this video, the ping is heard on both sides of the cow. So this is not a real, this is all just a demonstration, because you would never hear a ping on the left and the right. You would hear it on the left if the abomasum was displaced to the left, and you would hear a ping on the right if the abomasum was displaced on the right. You know, if it were flipped a little bit, or if it was twisted. But I think the whole video is useful to watch, to see a whole physical exam. You'll see some terms you've heard before, like bruxism, but the ping is the part I want you is why I'm showing it to you. I'm not sure if the volume is on, so I may have to pause it. We'll see what happens. There's a description of what you're hearing. There she's blotting the, not blotting, but ballotment of the rumen to see if it feels full. Or they call it succussion. Remember, torsion is the same as volvulus. And then this is how you do in the final part of the exam, checking the mouth. I wish we could go to a dairy. I don't know if you know this, but it's dairy cows. Well, farm animals are, that's what inspired me to become a veterinarian. So I really love farm animals. Okay, so sometimes though, the cow looks and acts like she has an LDA, but there's no ping. So if you're uncertain, if the veterinarian is uncertain, we can do the lip tack test. And what that really is it just means, I guess you would call it like abomasocentesis is what we're doing. We're gonna shave and clean an area and basically stick a needle in to draw out some fluid. So here we are on the left side of the cow, and you know, if there's no left displaced abomasum, the fluid we get should be from the rumen. And if it was the rumen, it's not acidic. We would have just normal, we'd have sort of maybe alkaline fluid here. But if the abomasum has displaced, then the fluid we get will be very acidic. And I've done this, and Casey has done this with me to see, there really is a left displaced abomasum. We just can't hear the ping. There's different ways it can be corrected. Here in the Western United States, we do a left flank laparotomy. That's what you saw me doing. What you saw Nell doing was the right flank laparotomy. And with this technique on the left, what the veterinarian does is they actually push the abomasum back onto the right side underneath. There's really no good video to show you that, but we push it back, and then there's a way of actually tacking it to the body wall. And the right flank, I do have a video of the right flank approach. With that approach, you reach through, you let the air out of the abomasum, the veterinarian does, and then the veterinarian is going to pull the abomasum back to the right side, and then tack the omentum onto the right side. The omentum, you remember, that's that hammock that suspends intestines, and it's quite large in a cow, and we can use that. But that's used more for in the Midwestern and Eastern United States. They use that to correct a left displaced abomasum. Obviously, if you have a right displaced abomasum, you need to do the surgery on the right side. So everywhere in the world, they would fix an RDA or abomasal volvulus. They would fix that on the right. And there's a third method called the roll and tack method. That's for LDA only. And I'll show you that when we get there. In my experience, that would usually be done on lower valued cows, not the most valuable cows, but a cow where the farmer wants to give her a chance. You don't have to be a veterinarian to do it even, because there's no local block, there's no incision, but you'll see that in a moment. Again, right here's the left flank approach, and I'm going to fast forward because what I'm doing is I'm going to run this suture through the abomasum, and even though it's not shown here, then I'm going to reach all the way in with my arm and sweep and push the abomasum back to where it belongs. But right now I'm just getting suture in there so that I can tack her abomasum down. This is what Nell was doing. So now we're on the right side of the cow, and there's the abomasum. So I think in the video the abomasum is going to be shown displaced to the left. So let's see what happens here. Okay, so there goes the abomasum floating onto the wrong side. Again, this is all omentum here. Now we're looking at the other side. So here comes that abomasum, right? This huge thing here, right? That's the rumen. Here comes our abomasum. I just want to pause this, right? When you do the lip tack test, you stick a needle in. That if there's an LDA, that's where the needle is going to get the fluid from, and that's how you can tell. Oh, that's the abomasum really is here. If there's no abomasum, then you just get rumen fluid. And again, I'm making my incision here, and I'm pushing this abomasum back. But you'll see what Nell is doing, right? Right, so there's Nell. She's going to stick her arm in. And she's got a tube with a needle. So she's sticking a needle into the abomasum. She's letting the air out. The air is going through that tube outside the cow. So she's deflating the abomasum, very carefully getting that needle out. And again, you saw, right, it's not just a needle. So if any juices come squirting out, they're not going to squirt inside the cow. They're all going to travel through this tube, which is outside the cow. So once she's deflated the abomasum, then she can reposition it. And so she's going to push, doesn't really show it too well, but pushing and sort of scooping the, she's going to push that abomasum back where it belongs. And with her other hand, I don't think it's shown here, but we're kind of going to be gently tugging on the, they do it with one hand, kind of tugging on the omentum. There's the incision. And so it's not shown, but now she can suture this omentum into onto the body wall to tack the omentum, and that should keep this omasum from wanting to go back. In this final method, the roll and tack method, what's happening is the cow, we get ropes on the cow. If I'm asked to do it, I give the cow some xylazine for pain and sedation. We get these ropes on, we can pull her down, and then we roll her on her back. So she's rolled into dorsal recumbency, and then the left side you'll see is tilted down a little more. Again, what's going to happen is the omentum, I'm sorry, the abomasum is going to float. It will, well, she's on her back, the abomasum will float in, how do you say it? It's going to float up, but it's floating, it's on her ventral aspect. And then we tilt her a little to the side so that abomasum will float back onto the right side. You'll see Dr. Brenda here is going to ping just to the right of the ventral midline. It's really fast, so you have to watch closely. But she checks, that tells her that the abomasum is back in the normal position. And then she basically is going to punch these holes through the skin and get this little toggle. It's basically a special kind of string with a little catch on it. And then she has a way of suturing these toggles together. It's left in place only a couple of days, but that should be enough time for the cow to feel better and start eating and not displace again.
Somebody come take this top leg on this side. It's tricky.
There's no
I think we get
subtitles,
one when
but
we've got
just
it rolled up
watch.
Because the cow is awake completely and not real happy about being upside down. Okay. Yep, go. When she gets upside down, she stops. Okay, hold. Got it with me. Hang on. Why don't you come take?
So in her back pocket that's the string I think she's going to use for the toggle to help keep the abomasum in place. And she probably gave this cow some xylazine or some other sedatives.
Take this other side since you've done it before with us. Yep.
We'll switch legs with you. Thank you. I'll go grab that one. Go.
All right, so you see that there, she's checking for the ping.
Okay, now I've got a nice ping here. The abomasum is here where we want it to be. That's where it gets exciting. This is where it gets exciting. That's right. So now I'm going to put a needle into the cow's stomach. If she decides to kick us, she's going to kick hard and it's going to hurt. So everybody's got to keep their eyes open and be careful. You want to go take your whole body, stand on this side, because otherwise you're liable to get caught in the face. We're going to suture her stomach back into place, and then we roll her on through.
Lordy, there we go, baby. We're gonna make it feel all better.
All right.
One way or the other.
Might stink for a minute, but life will be better because once we get her done, she can stand right up when we get her foot over. Okay, one more time. This is gonna be the worst one.
Why hello, baby?
All right. Okay, let go of the rope. You hang on to your leg. You let go of the leg and go that way. You go this way because she's going towards you. Stick her head up. Yeah, just get her head up a little bit so she'll land on that. Okay, ready? Yep.
Right, they want to roll her in such a way that it encourages the abomasum to stay on the right side. Now, I really love the show. However, that was not a very sterile technique, right? It would just take a second to shave the spot and do a little bit of a prep. You know, you could even put some lidocaine there. So this is not exactly, this is a little too old school, but this is, you know, this is the way it is sometimes done. But it doesn't take that long to just shave and clean. But anyway, they're gonna get her back up.
Push her over. Let's go ahead and try to set her up. And tie her head to her leg. We'll give her dextrose because she is not sleeping, remember?
She looks like she is.
I know she does, but she's not. She's not.
So yeah, she gave her xylazine, and also you heard her say giving her dextrose. So this cow probably has ketosis or something where she needs some more calories. But you saw how, you know, Dr. Brenda was concerned for everyone's safety, making sure you don't get clocked in the face. Okay. And then finally, post-operative care. Again, these cows will usually, we don't have to hold them off feed. They can start eating right away. It's not like a horse where we'd want to wait a certain amount of time before we let the horse eat. The horse would be at risk for choke, not a cow. Some of these cows, they're eating during the procedure. I mean, you're doing surgery on them and they're eating at the same time. So we usually give them something for pain. Again, flunixin, meglumine, that's Banamine. That's the one FDA approved NSAID for cattle. I keep thinking, is there some other one? So maybe I'm having a senior moment, but I think it's just flunixin, meglumine. That's all we ever had. We'd probably have the farmer give her penicillin, and we want to make sure that we've diagnosed and are treating the primary problem. You know, if she's got mastitis, treat mastitis. If she's got metritis, treat the metritis. Supplement her with calcium. If she's got hypocalcemia, give her dextrose. If she's got ketosis, we'll have the farmer or one of his employees check the incision. They can remove the sutures themselves, and we just need to be sure we record and communicate any milk withholding time. So while she's on Banamine and penicillin, that milk cannot enter the human food supply. It can be fed to calves, but it cannot, she's going to have like these little leg bands or something so that she does not get accidentally milked, and the milk does not end up in the grocery store. All right, so that's the end of part 1. Just to review, many small animal and equine surgical considerations apply. There are some differences, right? There's a much longer fasting period in cattle, but fortunately, most cow surgeries are standing and they don't require any fasting. There are certain drugs that cannot be used. I didn't show you that, but there are certain drugs that cannot be used, and there are, for example, like cephalexins. Like you might use convenia injections in a dog. That would be illegal in farm animals. We are just not allowed to use the cephalosporin family in cattle at all. And even the drugs that we can use, we need to make sure we adhere to and communicate any withdrawal times. There's different techniques. You just saw this gentleman here is doing the he's doing the paravertebral block. He's going to do it at some point. Am I crazy? Did I miss it? Well, he does do it. I'm just not sure when he does it. Anyway, oh, there he is. Okay, sorry. And then, and ruminants have unique gastrointestinal systems and problems, in particular, displacement of the abomasum is very common in postpartum high-producing dairy cattle. And there's almost always some other problem that led to the abomasum being displaced. All right, that is the end of part 1. I'll see you in part 2.